The Panorama 1 trial was another trial also in the 1 to 3 prior lines of therapy space that looked at Bortezomib and Dexamethasone versus Bortezomib, Dex, and Panobinostat. And Panobinostat is the first approved HDAC inhibitor in myeloma. It was approved in the US about 8 or 9 months ago, and I understand NICE actually just approved it in the last week or so. So the concept here is that the drugs are synergistic when you give them together, and we've seen previously that the progression-free survival was particularly long for patients who got the 3-drug combination versus the 2. The challenge with Panobinostat has been the toxicity. Given on its own, there is a GI toxicity issue, particularly nausea and diarrhea. When used with intravenous Bortezomib, which is the way the trial was done, that incidence was much, much higher. And so I think the take-home message from this trial, in my view, is that you have to pick the right patient population. And what was shown is that in a greater than 2 prior lines of therapy, Bortezomib and IMiD exposed patient population, the difference in progression-free survival was almost 8 months for the Panobinostat arm compared to the non-Panobinostat arm. And second, we really need to find better partners for Panobinostat. Carfilzomib, Dexamethasone, other drugs may be those partners. Given all the new drugs we've had approved, I'm not sure exactly where everything fits. Our personal approach is if we're going to use Carfilzomib in the salvage setting, we combine it with Panobinostat because the data looks so good and the tolerability is so much better than combining with Bortezomib.